Hello and welcome to Legislative Report. I'm Anthony Tezak. The new two-year legislative session in Harrisburg brings with it a number of critical issues for the General Assembly to tackle. Perhaps the most consequential to job creators and taxpayers is the implementation of several mandates contained within the Federal Patient Protection and Affordable Care Act, also known as Obamacare. What path will Pennsylvania take, and what could it mean for your health care? Lancaster County Representatives Ryan Aument and Brian Cutler are here to shed some light on this controversial federal program. First, thank you, Representatives, for joining me here today.
Good to be here.
And Representative Cutler, why don't we start with you? Can you give us some background information on the Affordable Care Act?
Yes, the Affordable Care Act is President Obama's premier piece of legislation or piece of domestic policy that he worked on during his first term. I think it's important to note that both sides recognize the shortcomings in our current healthcare system. And the Affordable Care Act really tried to provide insurance coverage to a wide variety of Americans that were previously uninsured. In order to do that, they had two major pieces of policy that they tried to implement through the statute. The first was the idea of the individual mandate where everyone would be required to buy insurance. And the second was an extensive expansion of the current Medicaid programs. I'm sure we'll get into it a little bit later, but particularly the Medicaid piece has severe implications to the Pennsylvania budget that we're going to be looking at in the upcoming years. And that's, I think, why many of the states were initially concerned about this proposal, and many of them even challenged it, taking it the whole way up to the Supreme Court. The Supreme Court has since ruled that the Affordable Care Act and its provisions are a function of Congress's tax power. And so with that in mind, that's the current decision that we have before us.
And what is the deadline for Pennsylvania to decide if we are going to participate in the healthcare exchange?
Well, Pennsylvania initially had until November the 16th of this year to make a decision in terms of the participation in the exchange. The federal government, the Obama administration, extended that deadline until December the 14th. So December the 14th of this year, Pennsylvania will have to make a decision. It's our opinion that Pennsylvania should respond firmly and should respond with a firm no.
Okay. And can you explain to us how exactly the healthcare exchange will work?
Well, the healthcare exchange is essentially an online place where those that are not insured can shop for insurance coverage. The challenge, of course, with this is the federal government has provided very little in terms of the specific details in terms of what should the state-run exchange, what does that look like, what are the requirements, and what is the cost. We believe this may cost as much as $10 to $100 million a year for Pennsylvania to set up and then maintain.
And can you explain what happens if Pennsylvania decides not to participate in the healthcare exchange?
The federal government, the federal Obamacare law has provided for a fallback provision. So if Pennsylvania does not set up our own exchange, the federal government will step in and will create an exchange for the Commonwealth of Pennsylvania. One of the challenges here, again, is the federal government's been short in providing details to Pennsylvania as to how Pennsylvania should set up an exchange. They've also not provided much information by way of what a federal fallback exchange will look like, and Congress has not appropriated funds to pay for the federal fallback exchange either.
Any comments on this?
Well, I think it's important to point out that the federal government's actually asking us to make a decision that we're going to have to commit to for many years into the future with incomplete information. Mm-hmm. And in some ways, that's how the bill got passed in the first place. It was passed without being thoroughly vetted, and that now we're seeing all of those problems come to fruition. I think we need to be responsible, and under both proposals, because I'd like to point out they're both clearly outlined in the bill. You can opt to do your own as a state, or you can opt into the federal fallback position. Both of those are legitimate choices under the bill. And I personally, like Representative Aument, believe that we should allow the federal government the oversight on this particular piece simply because they haven't provided enough information for us to know how we should implement the program going forward. And that's going to be important from the budgetary perspectives because of the maintenance of effort and many of the other requirements and strings that the federal government attaches to us when we accept money from them. We could actually start a program that's far broader and more expensive, but then be forced to continue it even though it's well above the minimum standards that the federal government would ultimately set at some point in the future.
Now, obviously, President Obama is singing the praises of this piece of legislation. Representative Aument, what are the pros and cons of participating in the healthcare exchange?
Well, again, I think it's important to note, as Representative Cutler has, that we're going to participate in the exchanges. It's whether it is a state-run exchange or whether it's a federal exchange. And our concern as stewards of the taxpayer is that this is going to be costly. It's going to be costly for the taxpayers of Pennsylvania, and the federal government's been very short in providing guidance and details as to what this should look like. So we're not willing to accept responsibility for their policy and something they're ultimately going to retain final authority on. So I think it really comes down to, I think there, as far as a state-run exchange, I think there are very few pros. I mean, I hear some that express a belief and opinion that Pennsylvania have greater flexibility if we set up our own exchange. But I think there are very few examples in history in which the federal government gives the state some responsibility to set up their own department, their own policy, but then retains ultimate authority in which the state's going to have any flexibility at all. I think we're going to surrender flexibility. So I think there are very few pros to setting up a state exchange. I think it's going to be costly. It's going to be costly to Pennsylvania taxpayers, and I think ultimately the state's not been given very much guidance as to how to do it. So I think the federal government should. It's their policy. It's their law. Ultimately, I'd love to see them go back to the drawing board and consider a new policy in its entirety. But if we're going to go the route of the exchanges, the federal government has told us to do it. I think they should set it up.
Representative Cutler, any additional comments?
I think it's important to note that when the Supreme Court upheld the law as being constitutional, they specifically did it under the taxing authority of Congress. So in other words, they're the ones who can levy the taxes and collect it. And they're going to be the ones who have the money. So in this particular case, since they haven't given enough guidance in order to make an informed decision, and we'd be asking them for the money anyway, I certainly think they're the best situated to implement it on a national level.
Now, some people that have spoken out against not participating in the exchange have said that this could hurt some of the pieces of Obamacare that have already been implemented, such as the pre-existing conditions having to be accepted. Is there any truth to that being affected?
No, I think it's important to note these are entirely different sections of the law. In that particular case of which exchange we're going to participate in, which is kind of the crux of the discussion today, those are outlined in the law. You can pick choice A or you can pick choice B. The other provisions, such as coverage up to age 26 if you're in college and you meet certain standards, or pre-existing conditions, those are all different sections of the law. Those sections of the law will still be enforceable whether it's a state-run exchange or a federally run exchange.
And Representative Cutler, Medicaid expansion is also part of the Affordable Care Act. Is this something that Pennsylvania should be participating in?
No, I do not believe we should be participating in that going forward with the proposed expansion. And quite simply, it's because of the money that would be involved. Something that is often overlooked in the Medicaid and healthcare coverage debate is the fact of how Medicaid and Medicaid reimbursement rates from the government impact us as consumers of health care and individuals who pay health insurance rates. And what happens is a phenomenon known as cost shifting. The federal government, through Medicare and Medicaid, they fund both programs. Medicare is run for senior citizens, and it's based on age, and the federal government reimburses for those costs. Medicaid is income-based, so it's regardless of age, you can qualify for that program. And they also fund it even though it's state-run. But one of the issues that's often overlooked is the fact that the federal government chronically underfunds both programs. So what happens is hospitals have to attempt to break even. So they end up inflating costs for everybody who self-pays or has insurance in order to offset the expected losses that are going to occur through the underfunding of Medicare and Medicaid. And in Pennsylvania, we had a study done by the Pennsylvania Healthcare Cost Containment Council that said that Medicare underfunding is approximately 16%. So that basically $1 of actual cost would only get you 86 cents in reimbursement. Medicaid, which is also federally funded, is significantly less than that. So it's difficult to expand that program, access to that program, without also giving us funding, and the federal government has not indicated that they're willing to do such.
And we estimate, just to add to that, and we estimate that just in the first 8 years, that the additional cost of the Pennsylvania taxpayer, just with the expansion alone, in the first 8 years ranges anywhere between 1.3 and 5.5 billion. So again, as stewards of the taxpayer, we think the expansion of Medicaid would be an irresponsible decision for us to make.
Do we have any other options outside of the Affordable Care Act to help expand insurance for everyone?
Yes. I mean, as a matter of fact, back in 2008, when I was the co-chair of the Healthcare Policy Task Force, we had written a letter to the Obama administration while this debate was going on and asked to be a test site for several unique initiatives. We had an entire policy package at that time, and unfortunately it was kind of put on the back burner because of the fact that the Affordable Care Act was being pushed and ultimately passed. But there are ways that we can better manage access and cost of care. Remember, the cost shifting that goes on by moving more individuals onto the government programs really impacts everyone. So we need to make sure, in my estimation, that we need to make sure that we can get more individuals access to insurance, not necessarily government insurance, since government insurance chronically underfunds. The easiest and first answer would be the federal government could fully fund everything they've promised. Unfortunately, they haven't done that. So then we're left working within that framework of underfunding. I would like to personally see some changes to the federal tax law. It doesn't make sense anymore to buy your health insurance from your place of employment. Individuals like my father, they graduated until the day they died, they worked at the same place. That's not the case anymore with individuals in our generation. I've had 5 different jobs since the time that I've left high school, very different jobs, and loved each one of them, but I had to give up my insurance every time that I left. And when you move into a new insurance plan, all those issues come up, pre-existing conditions, 90-day waiting period, COBRA coverage. I think it would be much better and much better policy to allow us to buy insurance away from the employer, have true competition in the market. Everybody does it with auto insurance now. I'd like to see that same kind of accessibility online through the internet, across state lines, outside of the employer. That would really revolutionize the way we deliver healthcare and healthcare insurance. Additionally, I think we need to look at some additional efficiencies. We start looking into some of these programs, and as many times we have programs that the state runs that aren't the most efficient. So we need to look at those, streamline those, make sure that people are getting the access to care that they need. So much of our expenses comes from chronically ill patients, individuals with diabetes, and they have other complications, but they won't go see a doctor because they don't have health insurance. Again, if we could make health insurance more affordable, more accessible, that would then allow them access to the care to prevent many of the costs that come down the road.
One of the key flaws to Obamacare is that we have expanded access without addressing quality of care and cost. The idea that you can expand the access to care and at the same time improve the quality of care and reduce the cost is clearly flawed. And as Representative Cutler has talked about, the House Republican caucus has led the way in terms of a free market approach to actually reduce the cost of health care and therefore improve the quality, which will in turn allow us to increase access to care. We've led the way in that free market approach. But first, we need to reject the health care exchanges, state-run exchanges proposed in Obamacare, and the Medicaid expansion. We need the federal government to revisit this policy and allow the states to explore this free market approach.
Well, Representative Aument, Representative Cutler, thank you for your time, and thank you for shedding light on this very important issue that's going to be coming up and we're going to be hearing a lot of in the next couple weeks.
Thank you.
Thank you.
That's all the time we have for today's program. If you need assistance with any state matter, please feel free to contact Representative Aument or Representative Cutler at their local offices or through their websites. That information will be shown in a moment. Thanks for watching Legislative Report.